edition of the special simulcast of the Neil Haley Show now with the ultimate men's movement with our host, Dr. Jack Rocco. Dr. Jack, we've gone full circle, haven't we, to now your own podcast?
Absolutely. I'm extremely excited. I'm down in Charlotte this week doing some training with the men's clinic down here. And then we're headed to Miami tonight to get training by the founder and the inventor, the owner of the Max X procedure, which is a male enhancement procedure. And he's got over 10 years of experience doing these. So this is going to be an interesting component to our men's clinic. But it's nice to be down here and experiencing these guys and simultaneously inaugurating the podcast. So what's better than that?
Exactly. All right. Who are our guests today, Dr. Jack?
Yeah, we have Gary Druckenmiller. Go ahead, let's introduce yourselves.
Yeah,
I'm just meeting Robert myself. So it's Robert Sundelius.
Sundelius. That's pretty good.
Sundelius.
Yeah,
Okay.
Sundelius.
Robert Sundelius and Gary Druckenmiller.
Mm.
Gary and I connected on LinkedIn when we were both commenting on some nutritional health related posts and noticed his page had a very interesting, passionate message about healthcare and not just your typical sick care, but this was a wellness message. And the word that really struck me was flourishing. And I think that really resonated with me and my intentions for the men's clinic. I've spent 30 plus years in the healthcare industry, and it's not the shiny, beautiful, perfect little soap opera world that we all grew up with thinking that medicine is. Once you get into it, both from the healthcare worker standpoint, but also from the patient standpoint, that there's a lot of struggling, there's a lot of hardship that is surrounded by this healthcare system of ours. Whereas life's goals are to flourish, to thrive, to be healthy, wealthy, and wise, to have loved ones and family, all those things that really make life worth living are what we should be shooting for. And what I believe the wellness care, the wellness system should be addressing and should be helping to encourage, not just get your blood tests so we can do more tests, so we can put you on this roller coaster hamster wheel of the medical industry, which no one likes and often don't benefit from. So yeah, the message that Gary portrayed in his post, and then we had a nice conversation afterwards, just really intrigued me with some of the ideas, the innovations, the ways to simplify, your wellness care. And this seemed like a very interesting, feasible project that they're working on. And I'm very interested to hear more and hear what they have to present. So go ahead, Gary, take it away.
Sure. Thank you both for having us. We are doing our grand tour, so the timing is perfect in terms of the velocity and veracity of getting our word out. So thank you again. It's an honor to be here with you, Dr. Rocco. So my background is two parts, and I'll hand it over to Robert. My first half is a consumer marketing executive for very large brands, both at agency side and client side, brands including Victorinox, Swiss Army brands, Timex. If you remember Sylvania Lighting back in the day, I was pretty much the inaugural member for almost all of those, including numerous others, in terms of their internet step into the world, not even revitalization or rejuvenation, their first forays into the web field dating back to the late 90s. The second half of my career has been in health tech. And I was invited to come in about 2009. I was a founding member for one of the first CRM companies for hospitals and health systems, a company called eVariant, which eventually exited to Healthgrades. And then I'm also former Innovator. Innovator is one of the largest data management systems and value-based care organizations for health systems, leading up until about a year ago, where Robert and I met each other. And today I am co-founder of the Human Flourishing Collaborative and our anchor product, Fhiggle, leading us into this conversation. So Robert, give a little bit on your background.
Yeah, great. Dr. Rocco, it's a pleasure to be here. 25 years in the medical care industry sector, primarily in the C-suite, Chief Administrative, Chief Operating, and Chief Executive Officer. 10 years consulting nationally with some global impact. And then most recently, executive role was with Ascension Health, one of the top tier health systems in the United States. My portfolio was 1.3 billion with about 6,000 team members. Coming through COVID, I had an opportunity to step back and do a little soul searching. And I realized I'd spent 25 plus years in a medical care industry sector where over the last 5 decades, we've invested trillions of dollars, and yet our society is experiencing all the wrong fruit. More heart disease, more diabetes, more obesity, more mental health than we've ever had. And those trend lines continue to increase. So I started researching and writing on this topic of moving from a reactive medical care system to a proactive system for the care of health. That got some attention. I was published at the World Economic Forum, started to receive calls from a number of organizations and individuals, both nationally and globally. And it's interesting, when the vision chooses you, you start to attract people, and you start to attract those with a similar why. So Gary reached out. He had read some of my writing. We connected. We eventually grew this 2-person organization to 4 co-founders, and we formally launched the Human Flourishing Collaborative, which is the world's first public benefit corporation created for the sole purpose of orchestrating science, technology, entrepreneurship, and investment toward human flourishing. And that's exactly what we're doing. We're starting with our anchor platform, Fhiggle, which Gary will unpack a little bit more. But we're committed to the remainders of our careers to build something where my children and their children grow up in a society with less societal burden, less chronic disease, and less pain.
That sounds fantastic. And I specifically appreciate that once you throw something out to the universe, how you can't help but to receive more than what you threw out. And I've experienced that with a number of different situations in my life, and I'm experiencing it right now. As this men's clinic starts up, I start throwing a little seeds out, and it's amazing who's attracted to it and what brings to it. So I commend you on that. And you're not just talking the talk, you're walking the walk. I love that. Gary, now bring us in. We talked a little bit about this on the phone, the idea of, it's called Fhiggle, right? Your product.
That's right.
And this is the summary of your whole ideas, if I'm not mistaken. You're trying to come up with a product that is gauging flourishment, gauging wellness, gauging health. Explain it to us a little bit.
Sure. So Robert and I bound together, as he mentioned, on an actual term. Robert's vision was extensive. Robert was looking out generations ahead. I was looking out maybe about 5 to 10 years ahead. But we had, which is perfect because that's the balance that we want. But we had a lock on a term, and that term is life score. So to unpack how we got to something so simple and so elemental, we have to hearken very quickly back at what got us here. There's 350,000 health apps in the market today. So the wellness market is ridiculously and utterly fragmented to the hilt. Nobody knows where to start, and every single app only focuses on a portion of your pathology and your physiology, only exacerbating the degree of difficulty to find common ground on where to start and how to make yourself better, and to answer one simple question: am I healthy? Nobody can really answer that, with the exception of maybe 5 to 10% of the American population, or the North American population. The rest, as we call the populace, are on their own. So Robert and I and our other co-founders found common ground is that we need to simplify all of this on the preventative scale, on the proactive scale, while still addressing the 4 major super needs that every single person on the planet desires in order to achieve flourishing. The first one is personal agency. You need to be the CEO of your health, not use it as a cliche or some sort of unfettered metaphor. You need to actually do that, which means you need to pay at least minimally viable attention to the things that surround you, the things that you ingest, the people you partake your life in. And we've actually already extended on that journey quite a bit for many of us, but we're still only focusing on some of them and not all of them. So taking that personal health agency and having organizations like what we're doing with Fhiggle, and Fhiggle is spelled Phiggle, and that PHI is intentional. because the PHI and HIPAA and many other regulatory environments are what's gotten us into this pickle where we don't have the ability to really talk about what's impacting us and have the ability to share our information with others who are going through similar things that we are. So focusing on agency allows you to start to do that. The second, and then having sovereign ownership over your data is also critical and a part of that agency, meaning you own it, fully vetted, everything, every aspect about what you know about yourself health-wise, leading to life-wise is yours. The second piece is incentives, that we need a better and more simplistic path, a path that is partially chosen by you and how you want to partake it, to be incentivized to become healthier. Not everybody's going to be a Division I athlete. Not everybody's going to be a professional golfer. Not everybody's going to be the top XYZ in the world. The influential world tells us we should try to achieve that, but 90% of the population won't. That's been proven over generations. So what does it mean for you to be healthy? We're going to be coming up with Fhiggle and the Human Flourishing Collaborative. We're going to be coming up with incentives that are for the populace to get you going. The third one is literacy. Dr. Rocco, you preaching to the choir here. Healthcare language from payer to pharma to health systems is ridiculously difficult for the average person to understand. And then to have to connect all three of those at the same time to make semblance of what your outcome looked like or your post-discharge program looked like or your value-based care program looked like, forget about it. Most people just don't understand the language. And then the last one is that since COVID, social isolation, which was supposed to probably either be slowed down or have an inverse effect because we were already isolated for a significant number of time, has only gotten worse, which is why our mental health crisis is literally off the charts. We spend more time looking at our phones and then looking and spending time with each other. We spend more time inside than spending time in nature. So social connectivity is a huge part of this. And as we go further into our time here, we'll begin to specifically address some of the key components of the product and of the idea for flourishing that begin to tap into all four of those. But those are the four main areas that we're going after with this initiative. And each one of those could be your company in and of themselves. We're doing all four at the same time in the most simplistic and easy way, humanly possible. Everybody in the world gets a life score. Everybody in the world gets a future life score to shoot for as an estimate. So now you have bookends on both sides. You know where you're at today, and you know where you're going to shoot tomorrow. One number that constitutes the bulk of your health and your life ecology and geology, all wrapped up into one number.
What's interesting, Dr. Jack, I'm going to piggyback with a lot of my healthcare clients, and that's why you're working with me, is why I can speak the healthies or understand and specifically do it with all the different healthcare clients that I have, and ones in many different modalities. Health is your wealth. As I was speaking to Clint Hurdle, the now hitting coach for the Colorado Rockies, and he brought up how important that is, and that he tries to tell that's going to be the driving force in so many ways. Do you have a testing measurement to measure that score? Because I know with now genetic testing coming around the pipeline, that we are the next real innovation in healthcare is going to be where basically like you take your car and your car will know in the next 5,000 miles our brakes are going to go, and 20,000 miles this. Are you envisioning this with your company in a way, using that type of genetic testing to be a marker to rate your scoring and all that stuff?
I can dive into that one, Gary. It's interesting. It's a great question. So what we are not doing is we're not competing with a Function Health or a Superpower or another organization where the first thing you do is go through 100 different batteries of tests. And we're taking the posture of a sculptor. We take away until only the most beautiful, elegant, and truthful remains. We believe that human flourishing is not a luxury. It is our most authentic identity, and it should be free for everyone all the time. And that's what we're going to start with our platform. So we're addressing all 6 pillars of health, including eating well, movement, nutrition, sleep, mental health, social connection, and self-care. We have science-rooted intake assessments based on those 6 pillars. We have very simple and elegant intake that will provide you with baseline biomarkers, whereby every person on the platform gets their initial base life score at no cost ever.
That's great. I love that idea of the incentive portion of your presentation, Gary. And it reminds me of one of my biggest pet peeves when we start talking quality metrics. Now, I remember as a child, my parents owned a little grocery store, and I remember it was the first time I ever heard from some old timer when they talked about quality and quantity. And quality and quantity are completely independent functions. So that when the healthcare industry then puts on this quality metrics, it's a quality and it's a measurement. Like quantity is you can't it's a quantity, it's a number, it's not a quality, which is a characteristic. You can't merge the two. So when healthcare puts on this quality metrics, it's arbitrary. You know, that you may say, how many times do you wash your hands per day? And it's an arbitrary 10 times a day is good and 4 times a day is bad. But in which circumstances? So they're arbitrary findings. The problem with healthcare that I really find is that people are going in with their own idea of what their own incentive is, what their own goal is. And some people just want to get in and out of the doctor because they just need the paperwork signed and they want to leave. Meanwhile, you got to put them through a battery of tests, a battery of quality metrics that you will be judged at as bad if you don't get the person into or out of in time. So I like the idea that the individual is defining their own quality metrics, their own definition of what it is that is important to you in your life as a father, a mother, a child, a boss, a follower. Each person has their individual position and their individual goals. And I do like that. Can you go into a little more about the incentives and who chooses what these metrics are?
Sure. Robert, why don't you continue on that one if you want?
Yeah, we believe that the care of health is a unique journey to an N of one. So the care of health to a single mom with 2 kids working 2 jobs in inner city Detroit is very different than the care of health for a high schooler in a wheelchair on a farm in Topeka, Kansas. They both, however, have an interest in flourishing. And we believe that life wants to be lived, not a little, a lot, and it wants to be lived abundantly no matter our current situation. So when you think about those 6 pillars, eating well, movement, self-care, social connection, sleep, mental health, all of those are applicable to every individual with breath on the planet. And each one has a very unique journey in their lived environment. It's interesting that we believe we address chronic disease once a year in a doctor's office, but the seeds of chronic disease are planted where we eat, sleep, work, play, shop, live, compete. We're addressing the unique lived environment of every individual, their ability to assess in those 6 pillars their current state, and then our offering, rooted in science, a journey to better. The incentives will also be unique to their lived environment. So a single mom in Detroit may need a Uber driver to take her to her physician appointment, where the high schooler who's living in Topeka, Kansas may be interested in something related to sport or something related to eating well. We're offering those unique responses. So the ecosystem within which you find yourself is being shaped and formed to resource, incentivize, support, nudge, and move you on your journey to better.
That's like you said, the definition of flourishing, what flourishing means to me versus to someone else. And I think I see that as the problem. You have insurance companies or lobbyists or whoever are determining that this is quality. This is quality. But to me, that's not what I'm looking for when I go to the doctor. So I mean, that's what I really loved about the general ideas that we started to touch upon. But this is someone, they're deciding their own needs within the system. And I really like that. But how do you bring that all together? You know, that sounds beautiful. That's a wonderful ideal. We should all be shooting for that. But okay, now here's where the rubber meets the road, the concrete aspects of it. How do you bring that to people? And how do you come up with this number and say that this number, once again, it becomes a measuring of a quality. And I always say shitty is a quality. Blue is a quality. You know what I mean? So qualia in the traditional sense, it's a qualitative. It's not a number. It's not a quantity. It's a qualia. So how do you bring these qualias into a quantity? And that becomes an arbitrary, they usually can't mix, but you're finding a way to take these qualia and making them quantia. How do you do that accurately?
That's right. Certainly, being shitty is not a referendum on the proactive health space, and it never will be. And I think that's a big part why we got into this. So let's start with the life score. Let's just define what this is and what it's meant to be. Because we want to make one thing indiscriminately clear is that we're not a medical company. And when we say that, we obviously really mean that. But what we are is an organization as an intermediary for the populace who currently, basically at every feasible level of the healthcare system, are struggling. And it's not just struggling in the system themselves, they're struggling with the root causes of themselves that they do not know how to manage, ascertain the understanding, and reconcile with it. Like you said, we have to pull together factions that have basically lived separate and independent lives forever at an N of one scale, as Robert said, because we are a B2C company. We're not B2B. We're going straight to the people. So in order to do that, we have to be rooted in science, but make it easy to accept the science, like the beauty of a tinsel lamp or pressing an easy button, right? So what is the life score? The life score is, and we're using these words carefully, is a directionally accurate yet comprehensive view of an individual's overall level of flourishing. And what does that mean? We integrate, as Robert mentioned, a series of science-backed, we have a PhD nutritionist on staff, so it's coming from a good place. We'll get to what he's built. Self-appraisals, select wearables, health apps, and other digital data across the 6 main pillars of health that Robert mentioned, including potentially even consumer-oriented medical devices. The subscores that are delivered by the 6 pillars provide the necessary insights into an individual's life balance, which is reflected in the single and master score, which guides the member toward areas requiring attention and improvement, such as diet quality, better sleeping habits, and so on. Those are the nudges. Those nudges are delivered, and this is why the timing could not be more perfect. In addition to what the feds are doing with Make America Healthy Again, and just the general populace finally waking up in a large respect, we're tapping into the AI movement as well, because AI, in all of its banter at a kind of a homogeneous, kind of non-philanthropic, non-daily desire type of attention that it gets, it has a massive place in vertical industries, stodgy industries that have really yet to retransform themselves to change them completely 180 degrees in the opposite direction, which is what we're doing. So we have AI models that we will be training at a preventative scale across all 6 pillars to provide emotional and temporal, matching your personality level AI conversations and nudges to that N of 1 scale that Robert mentioned. So lastly, the life score is rooted in science, combining existing validated measurements with new analytics and visualization tools. It adapts to the data that we retrieve and is available in that single number, and will continue to evolve as you age. And the more data that you provide to us, just like a Zillow's estimate, right? The more data that gets collected, the better your Zillow's estimate gets over time. Same exact level of thinking. Then all of that has to then be positioned as a B2C company. Easy, simple, genuflecting to the natural discourse of understanding in a nanosecond, so that consumers can connect to their science, but in a way that doesn't require a PhD on their behalf, doesn't require going through 30 different pages of documentation or a 15-minute assessment. None of that. We are transcending all of that, but we are still rooted in scientific measurement and quality, as you mentioned.
So Robert, how long till this gets launched? You have a lot of plans. What phases are you with the company right now?
Yeah, that's very exciting. We have core components of our platform that are already created in market. One of our co-founders has built and has in market the back end data engine, which is data sovereignty and will ingest all of the data from every source, built and in market. Our PhD, Josh, has built and in market a nutrition backed scoring engine, which is applicable to all 6 pillars, built in market, being used. We have confirmed collaborative efforts with 2 additional organizations, one that assists with a scoring engine, the other that is a very quick 30-second intake using your cell phone and creates biomarkers. We are actively in our pre-seed fundraising. We're raising $5 million via a safe, simple agreement for future equity. When that funding hits, we are 60 days from having our initial MVP in the hands of our first beta group, and then iterate every 60 to 70 days in extended beta groups. And we're looking to be with our final MVP in market at scale within 9 to 12 months.
Okay. So already things are up for people. So my question, I'm going to go bring it back to Dr. Jack, Gary. So right now, and then Dr. Jack, I'm sure has another question because it's very intriguing stuff. So people can already purchase on the platform and be part of it. Who are the ideal people, Gary, right now that you want to go to the site, check it out, and potentially sign up for stuff?
Yeah, so we're definitely building our wait list is probably the best way to put it, but we are being selective. So our acquisition strategy is to be exclusive within certain segments for the first year, diverse segments, varying age segments, varying generational segments. So for example, our first 2 to 300 will be ones who have expressed interest over the past 6 to 12 months in our idea and in our product. We know who these folks are. They've taken surveys for us. They've submitted their information. They'll go first. But our second one is through one of our co-founders. We have direct access into the First Nations and Indigenous tribes of Southern Canada and Northwest America. Why would we not want to start there? Literally the most underserved population in North America in terms of their ability to flourish and the integral application of receiving positive health standards within their domain, exclusive just for them. And then as a subset, we're going to look to start with maybe a couple of colleges, because a lot of giant movements like this, especially a movement that is very contrarian to the existing system, the youth loves that. And they love tapping into new ideas. So we're going to have an exclusive launch for a couple of colleges there too. And then it's going to extend. And then we'll look into other underserved communities. We'll look on adding more colleges. We're eventually going to target moms. Now, why would we want to target moms? Because as Robert mentioned, this idea, this product, this initiative is a mission that is meant to span generations. We're not trying to be some unicorn and IPO in 5 years. That is absolutely and incontrovertibly not what we're doing. This tool has to live way past us for our children and our children's children, which means moms right now, young moms or women that maybe perhaps want to be moms, have to think about the best and most naturalistic and simplistic way to manage their children's health at the earliest point imaginable. Perhaps even having a life score administered at birth as a standard protocol.
No, I know. I
Right?
see this vision, and I'm going to segue right back to Dr. Jack, because we could have a conversation. We'll definitely have to give you guys back on when it goes further into this process in any way that Neil, the media giant Haley, or Dr. Jack Rocco can help you in this vision. I look at it like, let's just give you an example of, there's the 3 credit bureaus. And this is like a kind of a little bit of an analogy, similarity. Yeah. So you have the different 3 credit bureaus, you have all that data, and you need to fix your credit score. There's really not, and then that goes with Credit Karma. And we're going to give you those connectivity. That's what you're trying to do with health. Exactly. That's how I'm wrapping this around as a marketer, saying, okay, that's what they're looking to do. I see how important it is, because the doctors do not, and no knock at you, Dr. Jack. We always speak the truth in different ways. They don't give that holistic point of view when you go to your PCP. And then when you go to the specialists, they don't want to talk across different other specialists. Everything has to stay in that specialist side. So you need, with AI's ability and the way you're going to give them enough input, yes, you could use ChatGPT to do a few little similar things, but you need so much input for the output. They're already increasing memory stages. So AI and ChatGPT can't even memorize things anymore across channels. You have to get rid of some of the brain. So you guys are going to be on this market that you're niche to see people's health. You're getting all these experts in there, putting all the inputs so you get the right output when you put in your blood test scores. You put in all these different things to say, okay, here's your health score. And tell me if I'm on the right track, guys. Here's your health score, and this is the health score you're at right now. And you're at a 50. You better go see your PCP. You better get your specialist now. You are on your way down to potentially dying in the next 6 years if you don't fix these things in different verbiage. But that's needed. Then you add the genetic test scores. And then all these companies are going to come to you and say, you guys are niche in this area. We need to partner with you. That's what Credit Karma did with the 3 credit reporting agencies.
Yeah.
That's my marketer hack going on. Go ahead, Dr. Jack.
You guys see why I have big shoes to fill. It's not just because he's 6'10". This guy is a brain giant as well. And
Thank you. I appreciate that.
He's got a big enough network and has thrived on his connections and his ability to bring people together across spectrums. But the thing that I really liked about this as well is when you talk about the wearables and even integrating some of the genetic information. And one of the big things that I have with my men's clinic is that men don't tell you, or they tell you what it is that they think you want to hear. How are you? I'm great. I'm great. I ran 2 miles today, or whatever. It's always this good. But I checked your cholesterol, or I checked your blood pressure when you came in, and that's not the blood pressure of someone who runs 2 miles. Did you really run 2 miles? So the accuracy of what people are saying, and this idea of patient satisfaction, that's along with quality metrics. You've got patient satisfaction. Some people will only be satisfied if you write them a prescription for Percocet on the way out. And if you don't write that prescription for Percocet, you're somehow a bad doctor. You're going to get a bad review. Patients learn to manipulate, but the wearables, if you have a constant glucose monitor when you're having spikes, when you're eating foods with a high glycemic index, and it varies a little bit on what your spike may be versus. So I like the idea of the wearables and the measurable factors, not just the patient satisfaction, is defining flourishing, because blood pressure is a definition of flourishing. Those are the silent killers. The insulin sensitivity, you could be measuring their insulin sensitivity, how they react to insulin, how they react to a glucose. You can do it on a day-to-day basis on a live time. I love that some accuracy, but also some personal reporting. And your 6 pillars seem to encompass a good deal.
Okay, so people need to get on the waiting list, and because it's going to be so when are you looking to launch this to scale? What do you think, at least that phase with the website and all that with the waiting list? Were you hoping?
Go ahead, Robert. You think you covered this before, but you can take it again, please.
Yeah, that'll be 9 to 12 months out. So we're starting with these beta groups initially. I would encourage folks, go to Fhiggle.com, Phiggle, sign up on the waiting list, go to aflourishing.life, put your name in there. We're going to be providing information about the collaborative. And remember, Fhiggle is our first anchor platform. When we talk about building an ecosystem for the care of health, think about all of the products and services that can come to a N of 1 in every geography, in every zip code, and quite frankly, to a national scale and a global scale. Our vision is long-term. We believe that the care of health has one critical outcome: keeping people from becoming patients.
That's great. And that's going to be a battle. Dr. Jack, add to that. Won't it be? Yeah.
Pardon me?
It'll be a battle, right?
But I said, when you put the patient in the driver's seat, I've got classic examples, but you go to the VA. When I was an intern at the VA in Wilkes-Barre, Pennsylvania, these guys would come in with a chart that was this big. And you're like, so what are you here for, sir? I got an appointment. What's your appointment for? Surgery. Did you have surgery? Or are you going to get? So now you've got this chart that's this big that you've got to somehow find through, and the data was impossible, and the patient doesn't know. But to have the patient be involved and educated on what is important to them, they'll be more likely. I'm going because I have an appointment, not because I have an issue that needs an appointment. So having the patient in the driver's seat is where they should be. It's their health, and they
Right.
need to be educated and
And
Right.
the and the
we would actually say having the person in the driver's seat, because we wear the label patient less than 1% of our life. And we flipped it. We put medical care at the center and figure out how wellness fits in. And we expect our hospitals to keep people out of the hospital. We expect our cardiovascular programs to cut down on cardiovascular surgery. They're not incentivized, they're not resourced, they don't have the leadership model, and it's not why they were created. So wellness, the care of health, is the 99% of life that we live. And we will have off-ramps and on-ramps to medical care. But what's critical is a person in their care of health realizing that it's not medical care. It's not. It's
Right.
what keeps me from needing medical care.
Yeah.
And it's an important clarity on the battle reference. The battle is with chronic disease.
Yep.
That's
Yeah.
the battle.
That's
And so
what's costing our healthcare so much. All right, guys, best place
Yep.
again, really quickly. Both of you we can connect with both of you on LinkedIn as well, right?
Yes, both
All
on
right.
LinkedIn. Gary Druckenmiller, Robert Sundelius. Absolutely.
Appreciate it. Dr.
Great.
Jack, great. And we got to go to the Ultimate Men's Clinic.
Yeah,
For you?
that's where I am. I'm in New Bedford, Massachusetts. We service the Boston, Providence, that entire area. It's an area underserved, a lot of men with male needs and male wellness. So that's where I'll be. And I'm
What's the
going to be here
website?
on
What's the website?
on the Ultimate Men's Movement. Our website is www.theultimatemensclinic.com.
The Ultimate Men's Clinic.com. And the Ultimate Men's Movement has just had their first inaugural podcast. Thanks again, Dr. Jack. Thank you, Robert. Thank you, Gary.
Thank you.
Appreciate it, guys. That was
Thank
a special
you.
simulcast, The Neil Haley Show and the Ultimate Men's Movement podcast, guys. Take care.